Today, we're diving deep into bariatric surgery. It's this whole category of really powerful medical procedures designed for significant weight loss. But this is so much more than just an operation. It's a truly life-altering decision, and in many cases, it comes with permanent consequences. So let's get right into what that actually means. So you have to wonder, what's the tipping point? When do doctors and patients look past all the diets and exercise plans and decide that the operating room is the answer? What's the actual medical line you have to cross for such a huge intervention? All right, we're going to break this all down into 5 key parts. First, we'll look at who actually qualifies for surgery. Then, we'll go through the pre-surgery checklist, because it's a big one. After that, we'll explore the 3 main types of surgery, compare the pros and cons of each, and finally, we'll talk about the massive long-term commitment that comes with it. Okay, first things first. When is surgery even on the table? This isn't a choice someone makes lightly. It's all based on some very specific, very clear medical criteria. It's all about figuring out who is most likely to benefit and, honestly, who is a safe candidate for the procedure. And the whole conversation really starts with one single number, your body mass index, or BMI. It's pretty straightforward. It's a measure of body fat that takes your height and weight into account. And this number, it's the very first hurdle that every single potential patient has to clear. So here's the first clear line in the sand, a BMI over 40. If a person is in this category, which is generally classified as severe obesity, they can be considered for surgery based on that number alone. But that's not the only way. There's another path. If a patient has a BMI somewhere between 35 and 40, surgery becomes an option if, and this is a big if, they also have a serious related health issue. We're talking about things like type 2 diabetes or high blood pressure, conditions that could get a lot better with significant weight loss. Now, just hitting that BMI number isn't some golden ticket to the OR. Nope. There is a super rigorous pre-surgery checklist that every patient has to go through. So let's take a look at what that really involves. These are the guidelines from NICE in the UK, and they really lay out the hurdles. First off, you have to prove that you've given non-surgical methods a serious shot for at least 6 months. Second, you just have to be healthy enough to actually undergo the surgery and anesthesia. Third, and this is absolutely crucial, the patient has to commit to a lifetime of follow-up care. And finally, they have to be under the watch of a specialized medical team through the whole process. Okay, so let's say a patient gets the green light. They meet all the criteria. What actually happens in the operating room? Well, we're going to walk through the 3 main surgical options. The first option is the adjustable gastric band. A band is placed right around the upper part of the stomach, and what that does is create this tiny little pouch up top. It physically restricts how much food a person can eat in one sitting. The key things to know here, it's adjustable and, maybe most importantly, it's reversible. Next up, we have the gastric bypass, and this one is definitely more complex. Think of it as a 1-2 punch. First, like the band, it creates a small stomach pouch to limit how much you can eat. But then, and here's the big change, it actually reroutes your digestive system. That little pouch gets connected directly to the small intestine, bypassing most of the stomach, which means your body can't absorb as many calories or nutrients from your food. And the third major surgery is the sleeve gastrectomy. Now, this one is a resection procedure. That's a medical way of saying a large part of the stomach is permanently removed. What's left behind is this narrow, sleeve-shaped stomach. So this isn't about rerouting anything. It's about fundamentally and irreversibly making the stomach smaller. Okay, so you've got 3 totally different procedures, 3 different approaches. How on earth do doctors and patients decide which one is right? Let's actually weigh the pros and cons of each one. This table really lays out the trade-offs perfectly. Let's start with the gastric band. As you can see, its biggest selling point is that it's reversible. But the downside? The weight loss tends to be slower. Now, the gastric bypass, it gives the best results for weight reduction because it combines a smaller stomach with that malabsorptive element we talked about. But it's a tougher surgery to perform. And finally, the sleeve gastrectomy. It's a simpler operation, but the data suggests that those really promising initial results don't always last, which has made it a bit less popular these days. And this is something we really have to let sink in. Both the gastric bypass and the sleeve gastrectomy are irreversible. Once that surgery is done, there is absolutely no going back. And let's get real about those risks for a second.
The gastric bypass, because it's more complicated, has about a 2% risk of a leak where the intestine is reconnected. And a huge long-term concern is that up to half of all bypass patients can end up with a vitamin B12 deficiency. With the gastric band, the main problems are with the device itself. It could slip or wear away, and that would mean another surgery to fix it.
Which brings us to our final section. And honestly, this might be the most important one. The surgery itself might just be one day out of your life, but the commitment? Well, that's forever. And this quote from the official UK guidelines just says it all. The patient must commit to the need for long-term follow-up. This isn't just a suggestion, it is a non-negotiable part of the deal. We're talking about a whole new life of specialized diets, vitamin supplements, and regular, consistent medical checkups for the rest of their lives. So, I guess that leaves us with this one big question. While bariatric surgery can be an incredibly powerful tool to end a long struggle with obesity, it's pretty clear that in almost every other way, it's not an ending at all. It's the start of a completely new and very demanding journey.